Wendy, working with patients with pulmonary hypertension, one of the major symptoms they present with, for me, is breathlessness.
I think I'd agree with that. Most of the people that we see, their very first symptom that they actually go to see the doctors with is breathlessness.
And indeed, in my experience, breathlessness has a broad spectrum where some patients have breathlessness on minimal activity, while some patients, their breathlessness is so severe, it's breathlessness at rest.
And I think, yes, it's the whole scale. There are people who can only be breathless when they're perhaps walking up hills, and sometimes that's their first symptom, through to people that are breathless just talking.
And I think part of my role is to help manage that breathlessness. And I think drug therapies can be useful, but I think there's other interventions that can help. I find that goal setting with patients and also acknowledging activities with them that bring about breathlessness allows them to understand that we know that breathlessness exists.
And I think, and explain to them that breathlessness is a normal response to exercise, and to not stop exercising altogether to avoid breathlessness, but to be able to control it, to gradually increase the amount of exercise they can take, and to have techniques that they can manage their breathlessness.
When I talk to people with the symptom of breathlessness and pulmonary hypertension, we discuss means of how they can overcome it, looking at the activities they do, hopefully taking that one step further and building on it so that they increase their activity level and also take control of their breathlessness. That could be, for instance, when people with pulmonary hypertension are out shopping with friends, they may not be able to keep up with them. Often I'll advise them to do the window shopping approach to controlling their breathlessness, where they find that they're coming to a stage where they're thinking, I can't go on. It's the time to look into some shop window and take time to relieve their symptom.
And I'd agree with that. If you know that it's a good time of the day, that you've got more energy and you're going to be less breathless, planning your activities and then also perhaps planning a rest time during the day as well. There's really sort of practical things that will help manage breathlessness.
I find with some of the people, they get a lot of anxiety about their breathlessness. And in that respect, I think we need to encourage them to use other techniques, such as relaxation techniques.
I think that's really important because it's the same centre in the brain that recognises anxiety as recognises breathlessness, and the two are often very linked.
Taking control of your breathlessness and learning techniques such as relaxation techniques are really important for people with pulmonary hypertension when they pursue simple activities such as washing, dressing, and even going to the bathroom, which sometimes can make them very anxious and very frightened. And that just makes their breathlessness even worse.
I think if you learn techniques to be able to cope with that, then you can take some control over your disease and hopefully improve quality of life and exercise tolerance.